With an infection, it is not unusual to obtain a culture in order to determine what germ is present as well as what antibiotic will work best to get rid of it. Regardless of how and where the culture is obtained, the same basic steps are followed. In this example, we have a patient with a severe ear infection with pus that has been coming out of her right ear for the past few weeks. This has not responded to antibiotics. A culture is obtained of the pus that is coming out of the ear with a Q-tip swab. This is placed in a tube for transport. In this second example, we have a patient that has been suffering from high spiking fevers. Blood is drawn from the patient and into a blood culture bottle. Once the blood cultures have been obtained, they are placed into a bag for transport. Both these culture samples are delivered to the microbiology lab where a technician logs the samples into a computer. The blood cultures are placed inside an incubator to allow any infection present to grow further before processing. The ear culture is placed in a holding bucket along with other samples that has been collected from other patients. The ear culture swab is moved under a special ventilated hood to prevent contamination. After labeling, the swab is streaked onto 4 different agar plates as well as a slide. Each plate contains a different type of medium or food which allows for differentiation of what germ may be present as it grows. A loop further streaks out the specimen on the agar plates. The plates are inserted into an incubator to allow any germs to grow. Sometime within the next 5 days, blood cultures which have been allowed to incubate are now removed and placed under the hood. Just as with the ear culture swabs, the blood cultures are applied onto agar plates, streaked with a loop, and placed in an incubator to allow for further differentiated growth. The slides which have been set aside are now brought over to a sink for further processing. The slides are stained and fixed with special chemicals followed by rinses. This process is used to gram stain any organisms present for rough classification of the infectious organism. Once the slides have been air dried, the slides are then examined under the microscope to visualize any germs present and classified as either gram-positive or gram-negative. In this case, gram-positive cocci are identified that resemble Staphylococcus. However, to determine whether MRSA is present or not takes more testing. The next day, the ear culture and blood culture agar plates which have been placed in the incubator are removed and carefully examined by a microbiologist. By seeing within which plates growth has occurred, identification of the infecting organism can be made and reported. For the ear culture, a diagnosis of Staphylococcus aureus is made. However, the next question is whether this infection is resistant to any antibiotics or not. The main concern with the ear culture is whether MRSA is present, otherwise known as MRSA. As such, sensitivities will be performed on the ear culture. The agar plates are taken to a station where a swab of the organism is diluted inside a test tube. A detector ensures the proper amount of dilution has occurred. A cartridge containing a panel of different antibiotics for the germ to be tested against is then placed with the test tube inside a machine that will then process the sample. The next day, the machine will provide a report of what antibiotics the infection is sensitive and resistant to, allowing a physician to provide the best antibiotic that will kill the germ. For the ear culture, it was found to be MRSA. The blood culture obtained from our second example did not end up revealing any infection in the blood. This culture and sensitivity process applies to any culture obtained from anywhere else in the body.